This in-depth conversation with Dr. Ramani Durvasula, a leading expert on narcissism and narcissistic abuse, explores the complexities of narcissistic personality traits and disorders, how to identify narcissists, and strategies for managing relationships with them. The discussion covers everything from the origins of narcissism and its societal rise to the difficulties in establishing boundaries, understanding abusive dynamics like gaslighting, and recognizing the traits that differentiate narcissists from other personality types. Dr. Ramani also shares critical insights about healing from narcissistic abuse and fostering healthy relationships grounded in empathy and authenticity. Dr. Ramani traces the increased visibility of narcissism to cultural and technological shifts over the past few decades. While narcissism remained a less discussed mental health area for many years, the advent of reality TV and social media platforms created a triple threat environment emphasizing validation seeking and shameless self-promotion. This cultural context fueled the proliferation of narcissistic traits across the population, making it easier for individuals with narcissistic tendencies to gain public attention and feed their insecurities without leaving home. The erosion of traditional community and family structures also plays a role, although Dr. Ramani points out that earlier theories did not capture the full complexity of narcissism's development. Narcissism stems from a complex interplay of genetics, temperament, and environment. Every narcissistic individual Dr. Ramani has encountered shared a difficult temperament in childhood, characterized by low frustration tolerance, irritability, and difficulty in social situations. However, temperament alone does not lead to narcissism. Environmental factors such as inconsistent caregiving, childhood trauma, conditional love, and overvaluation or excessive praise also heavily influence development. The absence of a secure attachment during infancy, a loving, consistent, and responsive caregiver, is a critical risk factor for developing narcissistic traits in adulthood. Overindulgence, where children are constantly told how special they are without emotional support, can foster emotional immaturity and entitlement. Contrary to popular belief, narcissists do have an intellectual understanding of empathy, but lack genuine emotional empathy. They can mimic feelings to extract what they want, a behavior Dr. Ramani terms instrumental empathy. This ability allows narcissists to charm and manipulate others effectively, especially early in relationships, making them appear charismatic and engaging. However, their concern for others is superficial and self-serving. Once they have gained what they need, they quickly discard the emotional facade. Their empathy is cognitive and calculated rather than heartfelt, distinguishing them from individuals with psychopathy who show no empathy and less anxiety or insecurity. Dr. Ramani explains that narcissists, psychopaths, and sociopaths share traits such as manipulation and lack of regard for others, but key differences exist. Narcissists are deeply insecure and anxious, often experiencing stomach-churning shame and reactive sensitivity to criticism. Psychopaths, by contrast, have blunted autonomic nervous systems, making them fearless, unemotional, and coldly calculating, motivated by power and control. Malignant narcissists represent an especially dangerous subtype, blending narcissistic traits with paranoia, aggression, and sadism. They are more menacing, coercive, and abusive than typical narcissists, though still retain some insecurities absent in psychopaths. Relationships with narcissists often follow a predictable pattern, beginning with love bombing, intense, seductive attention designed to win someone over quickly. This eventually transitions into the devaluing phase, marked by subtle emotional abuse, invalidation, and criticism that confuses and traps the victim. The cycle often culminates in discard, where the narcissist abruptly withdraws, sometimes disappearing or inflicting silent treatment and emotional harm. Following the discard, hoovering occurs, where the narcissist tries to pull the person back in with false promises and future faking, empty assurances about change or commitment. This cycle frequently repeats, leaving victims emotionally exhausted and uncertain. Dr. Ramani emphasizes the importance of detecting narcissistic traits early in any relationship. Charm and charisma are common narcissistic bait, so it is crucial to watch how a person behaves under stress or disappointment. Narcissists often react with entitlement, anger, or blame shifting when things don't go their way. whereas healthy individuals respond with calmness, flexibility, and curiosity about others. Signs such as dismissiveness, lack of humility, and an inability to accept responsibility are warnings. Dr. Ramani advises that if you encounter someone excessively charming but lacking humility, it's best to avoid deep involvement. Changing a narcissist's behavior is extraordinarily difficult due to their deep-seated insecurities, lack of genuine self-awareness, and unwillingness to commit to therapy or self-regulation. Dr. Ramani advocates for a strategy she terms the deep technique. Don't defend, don't engage, don't explain, don't personalize. Maintaining emotional detachment helps reduce conflict escalation. In many cases, the healthiest option is no contact, although this is not always feasible, especially in familial or co-parenting situations. Radical acceptance, acknowledging the narcissist will not change, is essential for those who must continue interaction, accompanied by fiercely protecting one's own emotional well-being and cultivating supportive relationships and interests outside the narcissist. Children raised by narcissistic parents often suffer from emotional neglect, shaming, and unrealistic expectations aligned more with parental validation than the child's authentic needs. Narcissistic parents may be dismissive, controlling, and rageful, creating environments of walking on eggshells. The dysfunctional attachment formed can predispose children either toward anxiety or the development of narcissistic traits themselves. Conditional love, I love you if you succeed, rather than unconditional acceptance, fundamentally damages self-esteem and prevents emotional growth. One of the most powerful defenses against attracting narcissists is cultivating deep self-love and authenticity. Dr. Ramani refers to Carl Rogers' concept of lifting conditions of worth, meaning accepting oneself as lovable without attaching conditions such as success, appearance, or achievements. Narcissists exploit feelings of inadequacy, so recognizing one's intrinsic value reduces vulnerability. Authentic relationships flourish when both partners see the masterpiece in each other, a dynamic supported by the Michelangelo phenomenon, where partners help each other grow without jealousy or insecurity. Success in relationships requires mutual empathy, respect, and kindness, none of which a narcissist can genuinely offer. Victims of narcissistic relationships often experience symptoms akin to PTSD, including confusion, self-doubt, helplessness, anxiety, insomnia, and physical exhaustion. The cycle of idealization and devaluation leads to euphoric recall, where the abused person romanticizes the relationship's good times and rationalizes abusive behaviors. Healing involves recognizing these patterns, setting firm boundaries, and cultivating meaningful social support. Dr. Ramani notes the importance of community, hobbies, and sometimes alternative forms of intimacy for survivors, especially when they remain in contact with narcissistic family members or partners. Dr. Ramani clarifies the difference between narcissistic traits and the clinical diagnosis of narcissistic personality disorder, NPD. Only a small percentage of people, about 1 to 6%, meet the full diagnostic criteria, which includes demonstrable impairment or personal distress. However, approximately 20 to 25% of adults exhibit significant narcissistic traits that can severely impact relationships. The diagnosis requires a thorough clinical assessment, which many narcissists avoid due to their conviction that they are superior and blameless. Understanding this difference helps avoid overgeneralization and encourages more targeted strategies. Gaslighting, a prevalent tactic in narcissistic abuse, involves systematically denying a person's reality and causing them to question their sanity. It is a grooming process, not a one-time event, where the narcissist repeatedly invalidates the victim's perceptions with lies, deflections, and personal attacks. The gaslighter's goal is to maintain control by eroding the victim's confidence and inducing dependence. Recognizing gaslighting requires maintaining clarity on one's truth and refusing to accept manipulative labels such as crazy or too sensitive. Boundaries grounded in emotional truth are crucial to counteract this effect. Living with or maintaining relationships with narcissistic individuals, be they partners, family members, or coworkers, requires awareness and protective strategies. Accepting limited change, avoiding fights over trivial issues, selectively choosing battles around core values, true north, and cultivating external support networks help preserve mental health. In contexts like co-parenting, patience, and legal safeguards are vital, as family courts often do not consider narcissism in custody decisions. Awareness and education are the best tools to reduce impact and prevent further emotional harm. People who are non-narcissistic tend to exhibit empathy, kindness, flexibility, humility, emotional regulation, self-awareness, and respect for others. These traits foster authentic connections that allow mutual growth and genuine intimacy. Agreeableness, a personality style marked by cooperation and warmth, is the approximate antithesis of narcissism. However, agreeable individuals may be vulnerable to exploitation, especially in highly competitive or superficial environments. Selecting partners who demonstrate these positive qualities and avoiding quick commitments is foundational to healthy relationships. Narcissism thrives on the false self, a crafted mask designed to impress or intimidate. Dr. Ramani contrasts this with authenticity, the genuine self-actualization described by humanistic psychologists like Carl Rogers and Abraham Maslow. Authentic individuals live congruently with their values and emotions, fostering peace and connection instead of striving for status or validation. Greatness, in her definition, involves humility, self-awareness, compassion, and empathy rather than grandiosity or power. Athletes, entrepreneurs, and high achievers, conditioned to improve through effort and discipline, often struggle with narcissistic relationships because they try to fix partners who resist change. This drive to solve problems and work harder can increase vulnerability to manipulation and emotional drain. Recognizing when effort is futile and practicing radical acceptance are essential steps toward healthier relational dynamics. Narcissistic partners often engage in triangulation, creating jealousy by insinuating or fabricating rival interests to unsettle and control their victim. Distinguishing between normal evolutionary jealousy and pathological, paranoid jealousy is important. Narcissistic jealousy tends to be accusatory, delusional, and controlling. Maintaining emotional boundaries and refusing to engage with these tactics protects one's mental health. Dr. Ramani raises concerns about children raised in the social media era, where their lives are publicly documented without consent. This dynamic may contribute to narcissistic development as children become accessories to parental validation. Balancing sharing and privacy while maintaining genuine emotional connection is an ongoing societal challenge. Parents are urged to prioritize their children's emotional needs over social impressions. The ultimate advice Dr. Ramani offers is to recognize red flags early and not justify bad behavior. Trying to change a narcissist rarely succeeds without enormous commitment on their part, which is uncommon. Leaving abusive or toxic relationships, when possible, is often the healthiest option. For those who must stay, building resilience through learning, external support, and setting firm boundaries is necessary for survival. At the end of the conversation, Dr. Ramani encapsulates greatness as humility, self-awareness, compassion, and empathy. This contrasts sharply with narcissism's self-loathing foundation disguised by grandiosity and sets a standard for healthy human connection.